Warm welcome to our next session, where we're focusing on the latest research from the arts and cultural sector about social prescribing. So really excited to hear from our several speakers. Each speaker has got 6 minutes, so it's really a whistle-stop tour through their research, but a great introduction to the fabulous work that they're doing. So when each of our speakers has spoken, we'll then move into a Q&A, and as with other sessions, we invite you to post your questions and chat in the chat box. We'll do our best to monitor that, and also invite you to raise your hands and come and join the conversation by turning your cameras on and your mics on to ask your questions directly. So I hope that sounds okay. Just a reminder, please, when you're not speaking to everybody, to please keep your microphones on mute. We do get some strange feedback if we don't have people on mute. So if we can just remind everybody, unless you're the speaker, please to keep your microphone off. And without further ado, I'm really pleased to welcome our first speaker, who is well known to many of us, the wonderful Veronica Gould, who's done such amazing work over many years, starting Arts for Dementia and now running a really fabulous programme, which she's going to tell us about today, Arts for Brain Health, From Despair to Desire, Social Prescribing as Diagnostic Practice for Dementia. So thank you, Veronica, and we welcome you to screen share from now. And over to you.
Hi, hello everybody, and thank you very much, Helen, and to Social Prescribing for enabling GPs and link workers to direct people to life-enhancing arts to preserve brain health earlier than ever before. I shall structure this talk with reference to the NHS Well Pathway for Dementia, as illustrated in our report, Arts for Brain Health, Social Prescribing, Transforming the Diagnostic Narrative for Dementia. Each year, have we gone? Yes. Each year.
Just to say, we can't see your slides.
Oh.
Are you? I think you need to screen share again.
Oh goodness. Oh God.
I think Marie's put them up for you.
I'm doing it for you, Veronica.
Thank you,
you just need to say move slide, and I'm with you. So.
Oh, okay. Can you see wide-ranging inclusive, that one?
Bear with me. Is that the one you want?
Wide-ranging inclusive social activities, that one? Or should we start again? Let's start again.
Right, we're at the beginning. Off you go.
I can't see this. I can't see the slides. I can only see my slides. So, okay.
If you just minimize your presentation, you'll be able to see the desktop then.
Okay. Actually, I'll do it without it. Don't worry, if I can say next slide. Thank you, Helen, and to Social Prescribing for enabling GPs and link workers to direct people to life-enhancing arts to preserve brain health earlier than ever before. I shall structure this talk with reference to the NHS, please next slide, Well Pathway for Dementia, as illustrated in our report, Arts for Brain Health, Social Prescribing, Transforming the Diagnostic Narrative for Dementia. Next slide, please. Each year, there are over 200,000 cases in the UK, 10 million worldwide. Dementia, progressive degeneration of the brain, is our most feared condition, whose stigmatizing name is a deterrent. With no cure or even support until diagnosis, all would benefit from protection against isolating strain at the outset through participating in arts programs to preserve their brain health. By arts, I mean wide-ranging, inclusive, next slide please, social activities to revitalize the soul, to empower both person and partner to address modifiable risk factors, combat stress, reduce isolation, preserve sense of identity, of purpose and belonging, so that peri and post-diagnosis, their resilience in the community can continue for years longer. Next slide please. Our report, informed by 400 experts in dementia prevention, creative aging, social prescribing, culture, health and well-being, people with lived experience, GPs, memory services and local authorities, examines how arts address modifiable risk factors for dementia and protect against cognitive decline. Current diagnostic practice with case studies from patients and how GPs and memory services offer or plan to offer social prescribing. Examples of social prescribing, creative aging and arts for brain health, models for collaborative practice, for arts organisations to raise awareness to link workers and to achieve sustainable arts programmes. Next slide, please. As a third of cases of dementia could be prevented, risk factors and how arts protect against the advance of dementia are examined. Learning music or poetry or drama, exploring artworks challenges the brain to create new neural connections and pathways that can compensate for reduced activities in other regions. Opening the door to new discovery and engaging interest is the essence of cognitively stimulating arts, co-curating heightened sense of identity, purpose and connectivity as members of a resilient, socially active group. Social connectivity plays a vital role protecting people at this vulnerable cusp across all social backgrounds and cultural ethnicities. Arts fulfill their core psychological need, nurture social bonding, personal identity through collaborating and creative endeavour. Dance offers a joyous route to health and well-being, more effective than exercise alone in reducing body fat, fall prevention, and through music in improving mood, reducing stress and helping to maintain attention. Learning new steps to lead and follow enhances coordination. Music making provides a tool for total brain workout, improves plasticity in the cortex, which enhances the aging brain's cognitive abilities, perception, motor function, working memory, and improves cardiovascular strength. Music allows creative self-expression, reducing stress and giving a joyous sense of accomplishment. Group activities for well-being and camaraderie in nature help protect against obesity, sleep deprivation, anxiety, depression, and social isolation. Next slide, please. It can take years from the start of symptoms to get a dementia diagnosis. People often pass initial cognitive tests and may have to wait months for memory assessment, so GPs can help patients by referring them to a link worker for art support at the onset of symptoms. Memory services are now beginning to advise patients awaiting appointments to take up arts. Next slide, please. Link workers give quality time to discuss patients' and partners' non-clinical needs. Supported by regional learning coordinators, they research local psychosocial sources of support, such as arts, and can refer to the Arts for Dementia social prescriber directory for workshops and events by art form and postcode nationwide. If what the person wants to do doesn't exist locally, link workers may have access to a community builder who can support its setup. For individuals needing companionable support to access arts, Arts for Dementia has coordinated ArtsPal, a regional cultural and creative befriender network. Next slide, please. Arts for Creative Aging, to nurture resilience of individuals and their partner, run by arts organisations, community arts hub, heritage organisations, healthy living centres, men's sheds, nature and active organisations are detailed in our report. These are weekly participatory activities designed to re-energise and inspire, with arts teams trained in the challenges of mild cognitive impairment. Whether or not the diagnosis is dementia, participants continue to enjoy the group, co-curating, improvising, inspiring each other, as regional case studies and earlier Arts of Dementia reports illustrate. Next slide, please. Inviting arts, medical and social care students to volunteer and interact with arts workshop program participants aid early career understanding and dissertations, as we've heard quite a lot about today. So the way forward, next slide, please. For sustainable arts, the report highlights the NASP's place-based Thriving Communities Fund, a cross-sector partnership model ideal to raise awareness and funding and sustainability, and I hope it continues, or I believe it will in a different form. We propose, this is really important, an amendment to the NICE guideline 97 for dementia diagnosis to insert a recommendation to social prescribing to arts for brain health, which would thereby reduce loneliness and fear from living happier, for people to live happier and healthier lives from the onset of symptoms, and keep individuals and their family partners living healthier, happier lives in the community for years longer. This reflects our proposed amendment 290 to the Health and Care Bill. Our hope is that UCL and the Global Brain Health Institute will be able to take forward essential longitudinal research into arts for brain health. And finally, next slide, please. If you would like to know more, do join our free monthly Arts for Brain Health webinars run in association with the Optimal Aging Programme at the University of Oxford The next one's on Tuesday, the 5th of April, Visual Arts for Brain Health. Thank you.
Thank you. Thank you very much, Veronica. Absolutely fantastic. I'm going to hand over to our wonderful colleague, Victoria, who has now joined us, who's my co-host and co-chair. And
I'm so sorry.
It's lovely she got kicked out of Teams.
Thanks, Helen. It's really great to be here. I'm really happy that I got in just before Veronica started as well. Thanks for that incredibly succinct summary. My name is Victoria. I'm the Chief Exec of the Culture, Health and Wellbeing Alliance. So I'm really delighted to, and that staged approach that you described there, Veronica, was so helpful, thinking about the role of the arts at those 4 different stages. Thank you. In order not to delay proceedings further, I'm going to hand straight over to Stephanie Tierney. Also really pleased to hear from Stephanie because we were partners on this project. So Stephanie's from the University of Oxford, and she's going to be talking about the cultural sector's role in social prescribing for older people in the context of COVID.
Great, thanks Victoria, and also Helen, as you can see, was part of our research team for the project. So thank you for allowing me to come and talk about the project. And as I say, I'm talking on behalf of our team, who I've listed on the slide here. And I'm going to be talking about a project that was exploring how social prescribing within cultural sectors can support older people, particularly within the context of the COVID-19 pandemic. And the study was funded by the Arts and Humanities Research Council. So I need to just say at this point that what I'm saying today are my own views and not necessarily those of the funder or my host institution. So I've got 6 minutes, so I can't say too much about what we found, but I want to direct you to a report that we released this week, and it's a report of the findings from this project. So if you want to find out more about what I'm saying today, I'm going to give a very broad overview. Please do download the report from this website, or if you're having trouble doing that, please contact myself or Rebecca and we'll send a copy on to you. This then was our research question: cultural institutions as social prescribing venues to improve older people's well-being within the context of the COVID pandemic. What works, for whom, in what circumstances, and why? And in a moment, I'll run through what the actual research consisted of. But just before I do that, I'm going to be using the term cultural offer in the presentation. And by that, I mean the sorts of things that people might get referred to in the cultural sector as part of social prescribing. So that could involve things like being referred to a botanical gardens to get involved in some gardening projects. It could involve being linked to a library, a reading group, which might be online or in person. It could involve going to a museum to get engaged with activities there, or even volunteering for a cultural sector organisation. So what did we actually do for the research? Initially, we carried out a review which incorporated 42 papers to help us address our research question. And then when we'd done the initial review, we shared our findings with some stakeholders, and they were older people, cultural sector representatives, and people from the social prescribing world, to start to see if the ideas that we were drawing from our review of the literature made sense to them. After that, we then used our understanding from the review and the stakeholder groups to do some interviews. So we did qualitative interviews with 28 older people and 25 cultural sector staff. And at the same time, we carried out an online questionnaire that was completed by 148 link workers. And all this information helped us to understand in more detail how the cultural sector might support older people's health and well-being as part of social prescribing, particularly within the context of the pandemic. So what I'm going to do now is just say some very broad words about the main things that we found from the project. A key concept to come from the research was this notion of tailoring and the importance of that. So tailoring refers to shaping how a service or an intervention is delivered and what's offered to respond to individual needs and also to social circumstances. Now, how far tailoring is possible can be dependent on things like resources, time, capacity, skills. We did identify, though, in the research some components of tailoring that really relate to our research question. And these included Messaging, how the idea of a cultural offer is presented to an older person, and that usually comes from the link worker. Matching, this notion of how the link worker identifies if somebody might benefit from a cultural offer and how they identify what type of cultural offer might be relevant. Monitoring, so this using information that's collected through measuring things to improve what's offered in terms of cultural offers. Then this notion of maintaining boundaries, so being sensitive to how things might need to be shaped to make sure that things are safe and accessible, not just to the people receiving the intervention or the cultural offer, but also those providing it as well. And then this notion of partnerships as well, so having people in place, a range of actors are needed to sort of make the cultural offer work. The research also taught us about what type of broad things older people might get from engaging with a cultural offer as part of social prescribing. And these included this notion of immersion. So even if for a short period of time, whilst engaging in the cultural offer, people may be distracted, be taken away from concerns in life. The notion of psychological holding, so being involved in a cultural offer in a place where people feel safe and welcomed. Through cultural offers online and in person, people can make connections with others. And then also there was some evidence around this notion that involvement in cultural offers could be transformative. So could change how people saw themselves and their place in the world, could increase their self-confidence and their self-worth. So we used all this information from the literature review, from the interviews and the questionnaire to develop this model. And this model highlights how tailoring is needed initially to help older people to accept a cultural offer. And this is mainly about that interaction between the link worker and the older person. And this calls for good communication. Good communication is also important in how we produce cultural offers that are acceptable to older people, to ensure that the cultural offer is accessible, that it's safe, it's engaging and it's welcoming. And then our model concludes by highlighting these potential benefits that I've just talked about that an older person may be able to get from engaging with a cultural offer. And they may not get all these benefits, but these are the sort of broad benefits that we found from our research. So hopefully that's given you a bit of a flavour and has whetted your appetite to go and look at the full report. It's not that long, it's only 16 pages long. So please do download the full report, which gives more information about the project. And yes, thank you for listening.
Fabulous. Thank you very much, Stephanie. I put a link to the webpage where you can download that report. So
Perfect.
Thank you.
Thank you.
And I'm really pleased to welcome our next speaker, who is Louisa Peters. And Louisa is from the University of Huddersfield, and she's going to be talking to us about the importance of a safe and empowering context to enable mental health recovery within community-based arts activities. So thank you, Louisa, and over to you.
Thank you. I'll just try and share my screen. Hopefully you guys can see that.
We can. It's coming up. Thank you.
Right, yeah, thanks for having me here. It's very it was great to hear that research from Stephanie just then, because I'm nodding away as my research focuses very much on the individual experience of accessing, well, I'm looking particularly at community arts activities, but I think there's a lot of crossover with other activities that are socially prescribed, and my findings are showing what Stephanie is potentially, found in your project. So that's really great to hear. I'll whiz through what I'm doing. I'm a PhD student at the University of Huddersfield, and I'm halfway through a realist evaluation, and I'm presenting today some of the findings from my realist literature review. So can we get into here? So the aim of my research is to explore how my community-based arts activities influences recovery from serious mental illness, and that is recovery in terms of engaging with processes such as connectedness, identity change and hope, rather than symptom reduction. My research is going to be done over 3 years as part of my PhD. I've completed my literature review, as I said, and I've just started my interviews for my next phase of data collection. So phase 1, I did reviewed 22 pieces of literature on community activities, and also had an expert panel from third sector organisations, facilitators and people with lived experience to check and refine my research findings. There were quite a lot of findings from this, but I've decided to just focus on context today because I think this could be most relevant to people in the audience today. And one of the key things I found was that interventions and activities need to create a sense of safety and empowerment in order to enable a recovery to occur. And basically, if this didn't happen, then it was very unlikely people engaged with recovery processes such as connectedness, and there was a lot of disengagement with programs. Why this was seems to be addressed to do with the context of living with serious mental illness, and again there is a lot of crossover with a lot of other experiences of living with chronic illness. So things like stigma, struggling to cope with symptoms, feeling isolated and stuck, a lot of the things we've heard about today. And that's a safe and empowering environment created within community arts activities addresses some of these contextual situations that people are living in. How organisations seem to do this is the fact that community arts activities are non-clinical. There's a choice over engagement, so there's no sort of mandatory attendance, which seems to encourage attendance, promoting equality and that sort of anti-stigma kind of language used within the setting, and the fact that a lot of the activities focus on the actual arts itself, not recovery, but that's what seems to encourage the recovery to happen. And beyond that, the actual activities itself seem to reinforce the sense of safety and empowerment, so connecting to others through shared experience of both arts and mental illness makes it feel like a safe space to be and to open up. Learning arts helps with create new coping strategies, and also overcoming personal challenges, and that's very much down to the individual and could be anything from learning new skills to even just showing up is a challenge that people can overcome in this very safe environment. Like I said, this is just a few of the findings I found from my my research. I go into a lot more detail about the recovery processes themselves, but the next step for me is to test some of these findings through creative interviews with people with lived experiences and who are attending these groups at the moment or have been attending in the past. So I just thought I'd put my recruitment poster up for you guys to see basically what I'm doing. When I say I'm using creative arts interviews, I'm using things like visual elicitation. I have people bringing in poetry, music. So in terms of the evidence, the data I'm collecting, which links back to the previous talk we were in, I'm collecting interview transcripts, visual data and questionnaire data in order to sort of triangulate that and show to try and show those outcomes in lots of different ways, which I hope again is helpful for community organisations to be able to demonstrate their impact as well. So lots going on. Thank you.
That was fantastic. Thanks so much, Louisa. Yeah, all that work, that sort of bringing into our consciousness those questions around stigma and previous poor experiences and empowerment feels really important if we're going to start talking about building health equity. So I'm sure those are going to be very useful tools. We're moving straight on to Dr. Nicola Holt, who's from the University of the West of England and is going to be talking about delivering remote arts on prescription in a pandemic. Over to you, Nicola.
Hello everyone, thanks very much for having me. I hope that you can see my slides now. Yes, so I'm going to talk to you about some evaluation of a project that is ongoing but had funding from the Arts Council to run some arts on prescription in primary care and secondary care in Bristol, run through Fresh Arts at Southmead Hospital and Creative Shift, who deliver arts on prescription in primary care. And I was helping with the evaluation. The project wasn't originally intended to be online and remote, but it started around the same time as the pandemic hit, around April. So we had to shift the delivery of the arts on prescription to an online or postal format, delivering it remotely, and shift the evaluation online as well. So I'm going to talk you through the quantitative element of the study, what we found with the questionnaires we asked people to complete, and we're also doing some art-based interviews, the same as you, so that's good. So a little bit of background on arts on prescription, what we already know. We already know through qualitative work about the importance of the safe space and the impact that arts on prescription can potentially have on social bonding and self-confidence and self-esteem, like the previous speakers have discussed. And we've seen from quantitative work an increase in well-being over the course of programmes. So how we're trying to build on that work was to look again at further elements, looking also at loneliness, the impact of arts on prescription on feelings of connection to others and feelings of loneliness in everyday life, but also to use kind of mood tracking to look at the direct impact of the art workshops on that wellbeing change, to try and learn more about the mechanisms. So as I've said already, we had to shift the delivery online, and this image on this slide is an image of some of the art made from the postal intervention. We did most of the sessions using Zoom, where people still got together and made art in the way similar to the ways they might usually in a group. But some people had problems with access to digital spaces. And so for those people, the artists created a postal version where they were sent artwork to work on, and they had a sense of community by posting artwork to each other to further develop based on the exquisite corpse model, an image of which you can see on the slide. So previously, we'd found a lot of variation in wellbeing change in face-to-face arts and prescription, as you can see in this graph, the spaghetti plot. Some people felt much better, some people didn't. And we tried by mapping mood and how people actually felt when making art to understand that more, and had found that decrease in anxiety while making art explained some of that variance in wellbeing change across the programmes. And we try to build on that in this design by further looking at different cognitive elements of experience, like the flow state and feelings of social bonding in the art groups, as well as mood. So we had a pre-post design asking people about their well-being and loneliness and social isolation at the beginning and end of the programme, but also tracking how they felt before and after taking part in the art sessions. We had 65 participants, 9 of whom took part in the postal intervention, and most people were referred to help deal with stress and anxiety and also to help manage chronic pain, but most people were referred for multiple reasons. We had 711 sampled states of how are you feeling right now across the different art making sessions. So these are the scales that we used, including the Campaign to End Loneliness Measurement Tool, direct measure of loneliness, and mood scales, and a state measure of loneliness to ask how people are feeling in the art workshops. So I'm going to talk you through the results quickly now. So at a programme level, we replicated what has previously been found by researchers like Crone and Sumner, that over the period of the Arts on Prescription programme, wellbeing scores seem to increase. But we also found that even though this was delivered remotely, self-reported loneliness also significantly decreased. People were feeling lonely less often. However, the other measure of social connection and relationships was improved, but not statistically significant. So it seemed to impact people's feelings of being loneliness rather than their satisfaction with their relationships more broadly. When we looked at how people felt when making art, meeting up over Zoom and actually making it, we found a similar pattern to face-to-face workshops previously. People reported feeling less anxious afterwards, happier, more alert, and also felt less lonely and more socially connected to others. But what's most important, for me at least, or most interesting, is trying to look at if those experiences during the art workshops, whether they predict well-being change in the longer term. So that's what these graphs are trying to illustrate. So the results of the interactions here showed that people who reported having a lot of anxiety reduction after taking part in the art workshops, this explains some of the variance in wellbeing improvement across the programme. People who felt more relaxed afterwards had a greater improvement in wellbeing. That's replicating what we'd found before with face-to-face groups, but what was more interesting for me here, because this was a new finding, was that people who reported feeling more connected to others during the art workshops, they also, and it was a stronger effect, had a big increase in well-being compared to people who didn't feel connected to others during the workshops. And also, this impacted feelings of general loneliness in everyday life. People who left the workshops feeling connected to people, even though this was by Zoom, felt less lonely in their everyday life at the end of the programme than the beginning. So this is my final slide, and this is a picture of one of the activities that people were doing, crumpling up a sheet of paper and then filling in, colouring in the spaces there. This supports previous work that arts and prescription is a meaningful intervention that can improve well-being, and it suggests that this can work remotely as well using postal and online methods, and it suggests multiple mechanisms for the well-being impact through anxiety reduction, social connection, for example. And I think it has implications going forward to reflect on hybrid delivery formats and thinking about what formats might work best for whom and why. For example, potentially at Southmead Hospital, people could come from a wider area, and because they didn't have to travel as far because it was remote. And there are lots of advantages and disadvantages for hybrid delivery and online delivery, but I think some people might prefer one or the other, and that's something to reflect on going forward. Thank you. I finished now.
That's wonderful. Thank you so much, Nicola. And I think it is really interesting to think about these ways of capturing complex multisensory facets like social connection and flow. So it'd be great to chat more about that. Yeah. Well, we're on to our last but by no means least speaker, Pulaporn Sreewichian from Glasgow Caledonian University. You're really, really welcome, Pulaporn. And Pulaporn's going to speak to us about developing a better understanding of social prescribing of music activities in Scotland. Over to you.
Thank you very much. It's very nice to see a lot of interesting presentation today. Right, my name is Pulaporn, and this project is actually a part of my PhD study at the Glasgow Caledonian University. So yes, let's start with the background of the study. As we all know, and I believe that many of us already noticed that music has been evidence for having multiple benefits for health and well-being of individual, as maybe some population who's struggling with mental health illness or dementia or even COPD or many others health conditions. So it's not surprise at all to see that music activity has become increasingly popular as social prescribed support activity to help people in many areas, including in Scotland. However, one of the things we notice is that there is still a lack of shared information about practices of delivery, social prescribed music activities, and also lack of robust evidence on the impact of music activities in the social prescribing context. So there is a need for develop a better understanding in this regard in order for us to optimize the practice to deliver social prescribing of music activities moving forward. This leads us to the aim of the study, which is to develop a better understanding of the processes and practices of delivery and evaluate of social prescribing of music activity in Scotland. To achieve this aim, we conduct a stakeholder study. As you can see on the presentation, in this study, we use a method of semi-structured interview to collect data from 18 participants representing different stakeholders involved in social prescribing of music activities in Scotland. After the interview data has been prescribed, we use the method of thematic analysis to analyze and interpret pattern of meaning in the data that represent information about social prescribing in general and with music activities. After that, we also have the second phase of data analysis, which is to do our stakeholder analysis with the data we collected. This is to develop a more focused explanation of stakeholder level of involvement in social prescribing of music activities, and also to better define challenges faced by each stakeholders. And in this study, we are currently in the stage of data analysis with the thematic analysis. We actually aim to finish this by now, but due to some delay in data collection, so we're still in this process. In my study, the thematic analysis, I used a technique called a template analysis approach, which is a technique under the umbrella of thematic analysis. So it's involved, after we collecting data, it's involved develop an initial coding template, which could represent the potential theme that could emerge from the coding. So therefore, even though we are still in the middle of data analysis with the initial coding template, we have some potential theme that were for discussion, which could be the theme at the end of the analysis. As you can see on the left-hand side, those are the potential theme that emerge from the coding template. So here I have picked on the right-hand side is those are some of the information that we have seen from the coding template that are quite interesting, including information about stakeholders, attitudes, and awareness toward social prescribing in general and social prescribing of music activity in Scotland. We found that many stakeholders are actually aware of the thing called social prescribing, but in Scotland, there are still a lack of shared resources for stakeholders such as health professional or third sector music activity provider in the community to give them information about how can they get involved in the process of social prescribing, or how can they prescribe people to different activities in Scotland, or how can music activities provider provide their activity to people in the community through social prescribing scheme. So that could be something that we need to develop toward. And many stakeholders realize that there are more developed and more like a resource hub in England compared to in Scotland. The other interesting thing is stakeholders have reported perceived benefit of music activities in social prescribing. So there are some of the benefits that align with literature evidence, such as impact on health and well-being, or help them to connect with others, increase social connectedness, reduce anxiety. However, there are also the community aspect into that seems to be important to social prescribing. There's many stakeholders that mention to prescribe someone to music activity through social prescribing, it also strengthens their connection with the community as well, and also connect a person to more resources in the community, and they become a more sustainable support within the community itself. Moreover, we also found a lot about evaluation process that had been currently practiced, which is a lot of psychometric scale has been used to evaluate the impact of socially prescribed activities. For example, the WEMWEBs and the outcome star. However, the thing that we notice is that many stakeholders and link workers, social prescribers, has mentioned that there should be a more training to training resources for social prescriber on how to conduct the evaluation more effectively, even though it's not going to be sustainable tools for these stakeholders to use. And there are so much more information. If anyone interested to know about anything, I'm more than happy to share information. So yeah, we are still in the middle of the data analysis. However, we do hope that the finding of the thematic analysis will provide us a more broadened understanding of the social prescribing practice in Scotland, as well as the evaluation process that used to evaluate music activities in social prescribing context. And then we hope that the stakeholder analysis that we will conduct after this will give us a more focused picture on what to be strengthened in order to optimize the delivery of social prescribing in Scotland. And after that, a part of my PhD project after this is also to develop a guideline for third sector in the community on how can they be more involved in the social prescribing if they would like to prescribe music activity in this context as well. So right, that is the end of my presentation. So thank you very much, and I would be very happy to answer any questions.
Thanks, Pulaporn. That was fantastic. What you were saying about the lack of resources and mechanisms for people to get involved with social prescribing, I think would ring true for a lot of people in England. I know that this is an issue for a lot of our members as well. It's really useful to have that highlighted and to be thinking about those kind of infrastructural issues that we're all grappling with at the moment. So yeah, thanks a lot. I'm going to hand over to Helen for the Q&A, to kick us off with the Q&A.
Well, and thank you to all our speakers. What a fantastic range of presentations, and you managed to pack so much into your 6 minutes. We really appreciate it. So we're moving into our Q&A. We've already got a hand up from Debs, so I'll invite her to join us in a second. And that's the best way to connect with the speakers. Put your hands up. If you'd like to put your cameras on, you're very welcome. There's also some lovely stuff going on in chat. Do feel free to raise your hands, and we will do our best to pick up on your questions. Over to you first, Debs, and lovely to see you.
Thank you. All this research is fantastic. It's great that we're getting all this research out there, but I would like to see some research on quality of life. 11 years ago, I was an invisible service user. I had no hope, no aspirations. I took an overdose, and here I am sat here now. I've done art for 11 years, sold countless paintings. I've got a much better quality of life now. People know me. I have an identity. I have a purpose. I have hope and aspirations in life. And I'd like to see some research on the quality of people's life, but not just the person doing the art or the creative session, whatever it may be, but the impact on that. My daughters were coming home from school not knowing if I was alive or dead, not knowing if I'd functioned that day. Their education was secondary to my health. They've seen mum completely change and transform into this person. So they've pushed themselves now. So the quality of their life is better. The talks and sessions and events that I do, people get a lot from it. So it's like a knock-on effect. And I wondered if there's any way we could capture that. Anybody?
Fantastic question. Thank you, Debs. And Debs is such a fantastic advocate for integrating lived experience into research. I'll maybe get to say something more about that in a minute. Which of our speakers would like to pick that really important point up? Nicola and then Veronica.
Yeah, I'm happy to speak. I think you're right. It's really important not just to have quantitative evidence, but to look at the impact on people's lives. And I think with arts and prescription, it's an area that's kind of growing. So more research is kind of coming along. There is a little bit of work, like Theo Stickley followed people up 2 years later and looked at how their quality of life and the impact that arts on prescription had on people over 2 years, and found that they were more had more of a stronger sense of identity as an artist, or more engaged with their communities and felt better. And we had a master's student last year, Bethan, who interviewed people a year after taking part from our Creative Shift primary care groups and asked them about their experiences and quality of life. So we're kind of writing that paper up now. I think one problem we noticed, though, that the people who wanted to be interviewed were the people who found it worked. And often people declined to take part and said, well, I dropped out, so I don't think my experience is worthwhile. So what we want to know is also the other side, like why did some people drop out and why did it not work for them, and what can we do to help everybody have that life-changing experience and learn more about the other side of it. But you're right, the experiences of people taking part is really important to learn about.
Veronica, and then Stephanie, did you have your hand up, and then Louisa?
You're on mute, Veronica.
One two quick points. One, obviously, we need a massive, and we really need to get together on this, raising awareness campaign, a national, well, obviously international, raising awareness campaign of the value of arts and wellbeing activities. I mean, this is massively needed because there are quite a lot of, I think, studies. We all know the qualitative sort of studies, but I agree it probably needs to be better known. But it's the raising awareness, a public, public campaign, television, etc. We need to go and wham it out because social prescribing has well and truly come of age, and it makes a difference to you. Just one very quick one. Somebody who was diagnosed with vascular dementia, who did art and drama with us on a weekly basis, because she was so engaged, her memory and her reading ability came back, and her diagnosis was changed. For people like Robert Winston, who thinks it doesn't make any difference, it jolly well does. And we really, really need a national campaign. That's what we need, because the trouble is with our lovely and wonderful studies is that they're read by just academics or those in the field. We need actually the public to know how especially when they're at rock bottom, how they can be lifted up. Anyway, that's a thought.
But to do that, you must change the language, because people like me don't understand research.
Oh yes, absolutely. Talk normal language. Yeah, absolutely. Feel better, live better, enjoy life, make new discoveries.
And somebody's just put in the chat Deb's story. So Deb does fantastic work within the National Centre for Creative Health as an advocate for lived experience, and is doing some brilliant work with us around lived experience in research and how that can be better integrated. Stephanie and Louisa, did you want to come in on that? Or? Yeah,
there were just a couple of points. So I think that point you made, Deb, about the ripple effect that it can have on not just the individual. We did a review on the link worker role in particular, and I think that's something that has been hinted at in the literature, but maybe needs to be pulled out a bit, that it's not just the individual, as you say, who are involved directly in social prescribing, but it can have a ripple effect on a number of people. And then the other thing was the point that Nicola made, and I think that goes back to our idea of messaging that I was talking about in my presentation, how we present not just the arts and culture, but social prescribing in general. So we're doing a project at the moment where we're going and being with link workers where they work. And one of the things we're finding is that patients are coming and not really knowing what social prescribing, they've been referred by a GP, but they really don't know what social prescribing is. So there needs to be some sort of, even though GPs think that they told patients why they've been referred to the link worker, patients are going. So this idea of messaging, not just the offer itself, but actually what social prescribing is and how it can help the individual, I think is important as well.
Thank you, Stephanie. Louisa, did you want to?
Yeah, I suppose in a way it's quite reassuring to hear some of this, because my research is focused very much on the individual experience and on that impact of I'm looking quite a lot at like identity and how profound a change people can experience on a very individual level. And yeah, the research, the interviews I'm doing now are looking to expand upon not only that context but that outcome side of things, of that, like you're saying, the ripple effect. And it's interesting to hear that people feel like there isn't that research there, because yeah, I agree with Debs that, you know, there needs to be that you know, that's this is the whole point of all this, isn't it? You know, is the impact on that on the individual. And what myself and my colleague are doing, who's my colleague Steph, who's working in children, in social prescribing for children. We are hoping to disseminate this creatively as well, because we're using creative methods in our research within creative you know, organisations, and then we're going to disseminate it within the creative community beyond what we have to do for academia. And I think that is a way we have to get the message out there and use the voice of the people that are involved and get it out into the community, where people need to be inspired, like, you know, what Debs does with her advocacy work and getting it out there. So maybe I'll come back next year with some new stuff to share.
Thank you.
I'll be following you, Louisa.
Yeah.
Thank you, guys. I'm going to move us on to another question from Joe. Joe, would you like to put your question to the panel? Joe G.
Hi, yeah, can you hear me okay?
Hello, Joe, we can, yeah.
Perfect, thank you. So my question, comment is around the power of social prescribing on a community. So the ripple effect, not just for the person and their family, but for a cohesion in communities in general. The idea of people supporting people is something that's very attractive to me. And I feel that the way to really sustain social prescribing is to build in that infrastructure, which currently isn't there fully across the UK. We know this. My, I guess, ask is, when we're doing research or these papers are being pitched and ideas are being formulated, is there any piece of work happening around actually educating GPs on what social prescribing is? Because they are the front line for illness, regardless of what it is. Illness is health, mental health is health. And if you get diagnosed with a long-term health condition, you are also going to have a mental impact with that. You will feel disconnected. All these things happen, all these things are swirling. People go to their GP first. If the GP doesn't understand what social prescribing is, doesn't understand the offer, and doesn't understand the services in their area, it becomes a little bit of a referral dumping ground, unfortunately. And I speak as a current service user that has experience in this way. So I do agree that the language needs to be demystified a little bit. I do agree that the public need to understand what social prescribing is in order to kind of be a cheerleader for services in their area, and to also role model their own stories, like Deb's very articulately does. But yeah, I think the key, the gateway to a lot of this is within GP surgeries. How do you guys feel about that?
Who would like to pick that up? Pulaporn and then Veronica.
Right. As a part of my study, I also have a chance to discuss with, we call them social prescribing student champion. So we do also recognize that there are a lot to unfold about GP perception toward medical care, the current model of medical care toward medical practice. I would say that I'm not, that there's awareness about holistic health in the GP as far as I know from my study, but the awareness about social prescribing model in my area, Scotland, is still lag. So GP might know about holistic health is a good thing, but they don't know how to actually make an effective referral if they don't know about social prescriber in their area. However, that's a current GP practice, but underneath that, there are the way that people actually try to train the future health professional, which is social prescribing student champion. So they are actually try to include curriculum about social prescribing, and there are actually people who try to push out that and try to promote, make campaign in university. And for as far as I know, I think many medical students are now know about social prescribing, and they are trying to make awareness among Health Alliance student as well, and nurses students. So I think they are a very bright future for social prescribing and the perception to a holistic health ahead. Not might be that soon, but I think we are going there. And I do agree that it's a lot about infrastructure. I think a lot of people in the public, there are so many audiences in that we have to communicate about social prescribing among researcher, among service user, among general public, and among health professional. And each of these people would like to read or consume different type of information. So back to the previous question as well, I think the important thing that future researcher or whoever want to push out research has to know is who are their audience that will be reading their work and what platform should they communicate to them. So I think that's important as well. Right.
Helen, as you well know, Professor Martin Marshall is working with you, Chair of the Royal College of General Practitioners, and he is very much on side, and he was saying that they were seeing great examples of social prescribing helping GP teams to support and refer patients, in our case, at the onset of dementia. So I think the message is there is, Joe, it's just got to disseminate amongst all. We held a whole series of programs, cross-sector meetings, regional ones all over the country, and Scotland, Ireland, Northern Ireland and Wales. And actually the GPs, of course, were so busy vaccinating, but they did, each of them come. So they are all aware. It's just a matter of oiling the works, I think. And again, raising awareness.
I think you're absolutely right, Veronica, and you're right, RCGP, Royal College of General Practitioners, are supportive, but Joe, I think you're absolutely right that unfortunately not all are converted and not all know about it, so there's still a lot of work to do. I'm very conscious of time, and we have a hand up still from Vanessa, so I'm going to swiftly move us on because we only have 4 minutes left and I'm keen to get to Vanessa's question. What have you got to ask us, Vanessa? Can you unmute yourself? Can you see that?
Hi. Right. Yes.
Hello.
Probably slight lag. I just wondered what your experience or mechanism was for reaching the decision makers within health. So I know the role of arts and health coordinators are developing across health services, but it's a bit patchy, as in which health boards have one and which ones don't. But I wondered, you know, how you reach the decision makers and so on. I work for health, and I'm really interested in the arts. So my career has been in health, but my home passion is arts, and I'd like to bring them together if I can.
It's always brilliant to hear that, Vanessa. Thank you.
Is it easy to reach the decision makers, or, you know, within health?
Can I do something a bit cheeky and suggest that Helen Chatterjee has a go at that question as well?
I could please.
I know she won't want to step in as chair, but
I mean, the answer is, it's really, as you might expect, it's really variable because of the complexity of the ecosystem. And we've got these, a lot of our work has been very focused on, we've got these two really complex ecosystems, the community sector, voluntary community sector, art, including arts and culture, and the health sector. And we know that on both sides, and maybe Stephanie might want to jump in, is on both sides, there's so many different layers, and the hierarchies and the structures are so complex that for individuals from both parties to understand how to connect with each other is often not there. And what we hear a lot, and Victoria can maybe talk a little bit about this, is from organisations from the arts, cultural sector, the community sector, knowing who even to contact if they are working across health. What's the best contact person? If they contact someone, will they get back to them? How they can connect best with the target population. So they have a lot of success usually with third sector collaborators, but connecting with health partners. And on the other side of it, I think the health partners also struggle to know who it is that's in their community that's offering stuff, because, you know, we don't have a one-stop shop to say in your community, this is who's there. You've got this museum, this library, this group of artists, this, you know, friends group, this community group. And that's a real challenge, we know, for health partners in the sector. But I don't know if anybody else wants to jump in on that.
I suppose social prescribing, we're all prescribed to, that's the wrong word, signed up to. So that might be a vehicle in, but I just wondered, yeah, what people's experiences were.
Yeah, Victoria.
I think there are mechanisms that we've been trying to establish over years, really. The All-Party Parliamentary Group for Arts, Health and Wellbeing has been working through this group of creative health champions for some time. And the concept of that is to get somebody at board level in all of the NHS trusts and local authority public health teams around the country who can advocate for this work. And that's had a reasonable degree of success, although it's very much still a work in progress. I think we've been quite successful in terms of advocacy at sort of very high levels in NHS England, and as Veronica was pointing out, people like Martin Marshall are very much on board. I think it goes back to the previous question in a way, that sometimes the difficulty is about sort of local, hyper-local work, and how you can make those two infrastructures meet in a way that's helpful to both. And we're not the only ones battling with that. If you look at the work that National Voices have been doing, this is an issue across the voluntary and community sector, not just culture. So
lots of challenges ahead. What wonderful presentations. Thank you for your fantastic questions. Thanks to all of our speakers. We've run out of time, but I hope you've enjoyed the session as much as I have, and I've certainly learned a lot. I welcome you all to switch and leave this session and go and rejoin our final session in the Social Prescribing Conference. It's been great to meet you all and great to hear from our speakers, and see you on the other side. Bye, everyone.